You're watching the Fox 5 Morning News at 7.
Good morning to you. Coronavirus continues to spread. However, not all cases are to do if you have mild symptoms. Dr. Chaffoo, good morning. Good to see you.
Good morning, Shally. Good to see you too.
You know, we have seen the cases of the people who end up in the hospital, but they have also said that there is a very large group of people that will be either asymptomatic or their symptoms will be very mild and they may not even know that they have it.
You know, that's the issue, of course, with this disease. As you know, Shally, most people that actually get exposed to COVID-19 have minimal to mild symptoms, and they may not even go to see a physician or go to an emergency department and simply shrug this off as, you know, a simple cold or flu-like illness at worst.
You know, I think, and I probably am guilty of this as well, I'll admit, you get like the littlest run of the nose or a little scratch in your throat. You're like, oh my gosh, I
have it.
I have it. But the reality is we're still in cold and flu season, and you could have a lot of other different viruses right now.
We do. You have many different viruses. And you're right. Actually, you know, COVID-19 in its mildest form, which, you know, if we get it, fortunately, most of us would have that form of it, is, you know, feels very much like a mild flu illness would feel, you know, primarily upper respiratory symptoms, some fatigue, some headaches, maybe a low-grade temperature, and that would be about it.
If someone feels symptoms coming on, the scratchy throat, they start to feel a fever, what would you recommend for them to do now? Do you immediately go to the hospital?
No, that's the last place you need to go. The hospitals are overwhelmed right now with people that are very, very ill. So you don't want to go to a hospital. You know, for mild symptoms, obviously the common sense things, you know, you would want to drink plenty of fluids. Obviously, you'd want to get rest. For mild symptoms, taking Tylenol is best. You know, Shally, there are some reports of people that are taking NSAIDs having a worse form of the disease, but that's not been well worked out, but probably better not to use NSAIDs. Tylenol works really much better for reducing fever than NSAIDs. It's milder on the stomach and is probably a better choice at this point.
One of the challenges, and I actually spoke to a mom who tested positive for COVID, and then she's living at home with other family members and kids. So if someone does get sick, and whether it's with COVID or really anything, how do you manage that so that the whole household doesn't get sick?
Well, so that's really important. So self-isolation is most important, Shally, and that means, you know, finding a room where you're going to stay in, you're going to sleep in by yourself, really self-quarantine. If you can, a bathroom just for yourself. And then if you're having a caretaker, someone to provide help for you, that person should obviously be wearing a mask, using gloves, and then frequently disinfecting those surfaces that would be contact surfaces with a disinfectant, at least on a daily basis. And most importantly, don't go out. You know, obviously staying inside, staying away as much from other family members as is certainly possible.
Dr. Chaffoo, the one point that concerns me is over the past few weeks, we see these stories pop here and there of younger people getting sick and then having to end up to go to the hospital. When do you know you're at that point that you need to go in? Because it seems like some of these symptoms, they turn around so quickly, and there are people who tried waiting it out and did not get that hospital care to begin with.
Right. So the most important thing is, as we said earlier on, you know, mild symptoms, you don't have to go to a hospital. But, you know, the common sense things, obviously, if you are having shortness of breath, because we know that the serious form of COVID-19 is pneumonia, is overwhelming infection of the lungs. And so if you have shortness of breath, if you have extreme fatigue or extreme weakness, Shally, that may indicate one of several things. You may be hypoxic. Your lungs may not be getting enough oxygen. You may be dehydrated. You may have electrolyte disturbances, again, from not taking in enough fluids. A persistently very high fever. Those would be symptoms that are alarming that may indicate that this is something that you need to see your physician about to get help and getting better.
Dr. Chaffoo, myself, along with, I'm sure, most of San Diego have probably entire lives. Our entire and we're touching all these chemicals like the bleach and this and that. So what can we do to save our hands in the middle of this?
So you're right, Shally. The problem is that, when we wash our hands frequently, certainly with soap and water, but then with these hand sanitizers, we wipe away those natural oils that exist on the surfaces of our skin. And the problem is we do dry our skin out. So, the best thing is to use some sort of a moisturizer after washing our hands. Now, this is typically better to use a cream or an ointment than a lotion. A lotion is just thinner and doesn't penetrate as well. You want to avoid soaps that have any fragrances in them. Certainly, if you're going to use sanitizers, use those, sparingly, because the alcohol does tend to dry the skin out. And then there are other things you can use. There are actually, occlusive masks that you can put on the skin of your hands and wear those at night, or something as simple as just using Vaseline. Vaseline's a great product. It's inexpensive. It's readily available, and you can put that on, apply that on at night, and then just put on some gloves. And even something as simple as, drinking enough fluids, and then also considering a humidifier to increase the moisture in our ambient, our room environment. That will help to keep our skin nice and moist.
Okay, we will do that. I will start using Vaseline at night now. Thank you, Dr. Chaffoo.
Sounds good. Be well.
You as well.
Thank you.
Time